Welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners, create custom medications to help our patients get better. So in this episode, our guest is Dr. Robert Hedeya from the Whole Psychiatry and Brain Recovery Center in Bethesda, Maryland. Very excited to have you, Dr. Hedeya, on this episode. And we're going to be discussing today the use of ketamine-assisted psychotherapy. So before we get started, once again, welcome to the show. Could you please introduce yourself and your practice to the listeners and viewers?
Okay, thanks, Jay, for having me. I appreciate it. So I am a psychiatrist by training. I say now that I do neuropsychiatry because I'm dealing with cognitive decline and people with brain injury and things of that nature, as well as the traditional psychiatric stuff, as well as chronic fatigue and post-COVID syndrome, long COVID. So it's just broad, anything that affects the brain that I believe I can help, like things like ALS, I can't help. So I don't really treat that. But so it's a broader thing than just straightforward psychiatry. So I'm trained as a psychiatrist, board certified by the American Psychiatric Association and the Neurological Association as well. And I was trained also in cognitive behavioral therapy, hypnosis, psychopharmacology, and then in the mid to late 90s, I got into functional medicine, and I've been doing functional medicine basically since the mid to late 90s. Very intensively. I'm on the faculty at Institute for Functional Medicine. I've written 3 books and several articles, and then in about 2017, I started to get into quantitative EEG and transcranial, meaning through the skull, laser light treatments, and neurofeedback, neural exercises, and then most recently, ketamine-assisted psychotherapy.
Oh, wow. So before we get started, a very general disclaimer for everyone that the information discussed today is for informational purposes only. It's not meant for diagnosis or treatment. So let's dig into this, Dr. Hedeya. So, could you talk to us just in a very simplistic manner, what is ketamine? And, from what I use in the compounding center, we use it a lot for neuropathic pain. Topical creams that have ketamine is so helpful for patients with diabetic neuropathy. But in your specialty, could you talk to us about ketamine and its properties?
So ketamine, we can look at ketamine different ways. So ketamine was developed in the 60s, and it's a general anesthetic, and it was used primarily after development for animals, animal anesthesia, and then used for humans as well. But after 1970, when Nixon declared the war on drugs and all the research on psychedelics was halted, the only molecule with psychedelic properties that could be studied was ketamine, and so there's been a lot of study on ketamine. Ketamine itself we can look at the molecular actions and neurotransmitter actions. We look at neuronal circuitry actions. We can look at a lot of different levels. So if we look on the molecular neurotransmitter level, the primary thing people think about is it's an NMDA antagonist, right? So it blocks NMDA, but really, there are at least 14 other actions of it, and maybe even more, right? It affects dopamine receptors, opioid receptors, it affects 5-HT1A receptors, it affects, it's just anticholinergic, muscarinic. There's just so many actions that not worth going into. That would be a long lecture in and of itself, right? But the point is, it has diverse effects that way. The other thing is it increases, it seems to help the hippocampus to improve, and it seems to help regulate the thalamus, which is like grand central station in the brain, and deep in the brain. It's a big nucleus or big city if you think of the brain as as a country with roads and highways and networks and cities. Well, the cities are the nuclei where you have big clusters of neuronal cell bodies deep in the brain, and the thalamus is one of the major ones, a very complex nucleus, and it regulates how the brain interacts with the environment and the deeper in yourself. And it's a constant relay back and forth, helping organize. It helps to regulate the thalamus.
Okay.
And what we're seeing is that actually sometimes the surface areas of the brain are unstable, and it can regulate that, or with connectivity in different pathways, etc. So it has a lot of actions there. When you take ketamine subjectively, you can have a psychedelic experience, or you can have an experience that's what we call psycholytic. It's not really hallucinogenic, but you're very, very, very relaxed, and you are clear-headed, but you also can access things that you normally wouldn't really be able to access, similar to being under hypnosis. If you enter a good state of hypnosis, then you can access things like this as well. But this is almost like meditation in a bottle, or hypnosis in a bottle, and so, you're almost pretty much assured of having that kind of a state.
So you kind of described a little bit how it works in psychiatry a little bit. Now, combine it with psychotherapy. Could you talk to us about how your use of ketamine and then psychotherapy attached to it, like, could you almost walk us through what would a session be like?
Oh yeah, sure.
And the key thing I really want to for us to talk about is the importance of attaching or having psychotherapy be part of this therapy.
Yeah. So let's say you take ketamine straight, IV, in some kind of a dosage, and you have a hallucinogenic experience. You have a mask on, you have music on, you're not talking to anybody, you're not doing any therapy. You can have a psychedelic experience, not the same as LSD, but you're kind of outside of normal sensory patterns and perceptual patterns. And you can travel through the universe, see the universe as one. You can have a transformative experience. You can. But it's very different than what we do. We do ketamine-assisted psychotherapy, and that's very different. So typical, that's the psycholytic, where we actually are able to break down. We're not breaking down. The medicine breaks down defenses that we all have. So a typical session would be, depending on the method of administration, it could be sublingual troches, it could be intranasal, it could be intramuscular. But let's say intranasal, we'll use it as an example, or sublingual. The sublingual seems to take about 20 minutes. Yeah. Onset, the intranasal is almost like 2 to 4 minutes, I would say. And so let's say intranasal, what we would do is, have you in a comfortable room. We've prepared you for this. You've met with the therapist 2 or 3 times to think about what you want to focus on, which you might focus on, you might not. You know what to expect to the best of your ability of understanding something. We put you in a kind of room that's quiet, a little music in the background. We turn the music down once you start doing the work, just to kind of relax, cover yourself with a blanket, have a pillow, eye mask, and you just start relaxing, your toes and your muscles, and and then you kind of go to a safe space, and so the beach or a room that's comfortable, the forest, something that you like. So, and you just start to relax, and your muscles relax. And you go, well, I'm really relaxed. And then you just, if you want to focus on something, you can, or not. You kind of, the main thing is to just kind of see what comes to you. Where does your psyche, where does your mind take you? And the mind it's quite remarkable, because it knows where to go. And it might seem like you're going nowhere, and you're going nowhere, and you're going nowhere, but eventually you go where you need to go. It's quite remarkable. And so I'm really kind of not the guide, or I may be doing the guardrails, but the psyche is the guide, So I generally tell people, if you go somewhere and you're facing a fear, just kind of watch it, because observe your fear and see, what happens. And I don't think I've had anyone have a fear on the intranasal, but on the IV, yes. And this person had a fear, and she felt like she was going to be suffocated. And she just said, I'm just going to see how this goes. And it just dissolved. And as a result of that fear of suffocation, a lot of her other fears in real life actually dissolved. Because this is the funny thing, Jay. The mind, the brain, the mind works in the most weird way. The most weird way. It's like pre-verbal. It's not like logical. It's just not logical at all. And I'm going to give you an example. It's personal to me. Okay. Okay. So I took the ketamine before I gave it to anybody because I wanted to know what it was like. And well, it was okay, whatever. And then one day, I hadn't given it to any patients. One day I developed some neck pain. And over the course of 2 or 3 days, the neck pain got worse and worse and worse. And then one night I was like, I'm in so much pain, I can't even turn my head. It was horrible. I couldn't even lie down in bed and find a comfortable position. And so I had this pain when I was a kid, like maybe 3 or 4 times, which is weird because I was a very healthy kid. Why would a kid have neck pain? It's kind of weird, right? But I never wondered about it. I'm in so much pain. And I said to my wife, I got to take some ketamine because ketamine works for pain. And I don't have anything for pain. So I just took some ketamine. I was like desperate for relief. And then I said to my wife, I said, come do some therapy on me. She's a psychologist, right? Okay. I said, honey, do some therapy on me. So this is my beta test, right? And well, here's what happened in a kind of a nutshell. Here's what I learned. My son was coming into town, and I had a certain kind of conflict with him, which was, I kind of knew, but I didn't understand, and it's been going on for years and whatever. And I have several sons, so you won't know which one it is. So if anyone wants to research, they can't figure it out. So anyway, I had this conflict, and so I'm like, oh, I have a pain in the neck. Oh, he's a pain in the neck. And I'm going into this thing, and all of a sudden this image comes to me from when I was like about 9 years old from my living room. It was a painting of a bullfight with the bull had this dagger, whatever they call those things that they put in the bull's neck. Yeah. That's what this pain was like, as if I was being stabbed in the neck. So this image came to me, right? Yeah. And I'm like 9 or 10 or whatever. And then I realized, because I have my older brother, and what I put together is that the conflict that I had with my son was actually an echo of the conflict I had with my older brother. And so I was so probably what my mind did, this is probably what my mind did. My mind, probably I got tense with this conflict. I compressed my discs, from the muscle tension, pressing on a nerve when I'm 9 years old. And my psyche sees this picture of the bull and links the picture with the pain and registers it that way. And now, I get that whole package as I'm 71. I get this whole package, 62 years later. Yeah. And I'm like, what the hell is this? I mean, I didn't do anything, right? And now I understand that I have a transgenerational conflict that I'm part of. And it's represented by this thing that my brain saw when I was a kid, and it's all smushed together, and it's acting on me. And I don't know what this is telling me, but that's the language of my pre-verbal or unconscious. That's kind of where ketamine gets you to. It gets you into this realm that you could be in therapy 100 years. You'd never get there. You'd never get there.
So thanks for sharing that.
So P.S. The pain went away, yeah. And now I understand the conflict, so I'm not bent out of shape anymore over it,
And so now that ketamine is being used as a tool for patients with depression or refractory depression, anxiety, is that basically how, in a sense, it helps those patients, is that they just get to relax and the mind leads, you being the psychotherapist, leads to kind of unfold and uncover the cause? Is that, in a general sense, is that how it helps patients with depression?
Yeah, on one level, yes, but I'm going to show you something else. I'm going to
Okay.
share the screen, for people who are uh, watching. They can see my screen here. Okay.
Okay.
Now you see on the left is the pre-ketamine. This on the right is post-ketamine. Okay. Now what you have here for people who can see or people who can't see, we have the brain, and wherever it's normal, the brain is gray. On this is imaging we do in a person's home,
Okay.
and it takes about an hour or so. And then you see these lines here, light blue, dark blue. That means that these neural pathways are slow in communicating. And the yellow lines are the specific neural pathways. I could tell you exactly the names of all of these. And the yellow is over communicating, which is also doesn't work. And then all the gray is, again, normal. So you see here on the left, this is in alpha. This is in her relaxed state.
Okay.
Pre-ketamine, you see that if I could turn this image, which I can't on this computer, but if I could turn it, you would see that the left and right sides of the brain are not really communicating well at all. Okay. And this pattern here in the front is light blue area, which is like a horseshoe between the right and left prefrontal cortex. This is a depression pattern, right? And then we gave her the ketamine. And this is a woman who had actually had been diagnosed. She had a lot of PTSD. She actually was diagnosed with multiple personality disorder and depression and, mold problem, a whole complex. Yeah. This is her QEG, her imaging 2 hours after the ketamine. And you see here, the entire brain, the entire cortex is normal. This blue here at the bottom is likely muscle. So it's an artifact. Everything is normalized 2 hours later. This was the first patient that I did on ketamine 2 hours before ketamine, 2 hours after ketamine. I was blown away. So that I call this file WOW. That's the file name.
So basically, on the right-hand side, with where the green, the image is gray, all the neurons are connecting and firing, whereas the other one, you can see where those roads are kind of blocked that you talk about.
That's correct. Right. So now that lasted for about 12 days. We repeated the QEG, and it was still a lot better. It wasn't quite as good, so the benefit decreases over time. So we do the treatments roughly once a month. We don't want the brain to get accommodated to it, so we do it about once a month with psychotherapy. And the session's about a couple of hours, and where the patient's being monitored. And then we're, obviously very careful. We have a couple of people in the room so they feel safe. We record the session, we give them a recording, and then we have integration sessions, the following days after that. And this is her. Now, other people have different benefits. About 80% of people seem to benefit. About 20% of people don't. So that's why we like the QEG, because we can get the baseline, see how it affects their brain, and then we know if it's helping their brain or not. Because if it's not, we're not going to do it anymore.
Gotcha.
Now, how come this is helpful in her? Because her brain is now functioning. It's like you have hardware. Her hardware is working now. The software is her psychology. Well, now her psychology is better. The therapy helps her psychology. So we have hardware, we have software, which is the way you think, your thinking patterns, your attitudes, your values, your beliefs. Okay. And then we have the cloud, which is your spiritual. So we deal with the hardware, the software, and the cloud.
So you do the therapy, you said once every month, right?
Roughly.
I'm sorry?
Roughly once a month, yeah.
Okay. Does the patient continue their ketamine treatment with a troche or a nasal spray, throughout, like every day or any, like, no, it's just that particular session?
Yeah. Well, that's that session. I'm not against using it like every couple of weeks. I don't want people to get dependent on it.
Yeah.
And I don't want to downregulate the receptors, which will happen because that's what happens to all receptors. Yeah. If you keep using it, you're going to downregulate them, and then you're going to have to use it regularly all the time in order to get benefit. And you can even, in some cases, you could lose the benefit. I have a patient who came to me. he's taking 30 milligrams of ketamine intranasal every 3 hours, or every 5 hours, something like that, for 2-3 years, right? And that's a lot of ketamine. And now he has to use 50 milligrams instead of 30 milligrams. I don't want to get in that situation.
Yeah.
So, I think it's really better to, that's the way I use it anyway.
Gotcha. So, what types of patients or conditions does it, in your opinion, work well for, that you've seen tremendous results with?
Yeah, I would say the best category is the anxiety category, and under that you could put PTSD, OCD, trauma. I would put the anxiety category. Depression, I don't know yet. Now, this woman I just showed you, she was depressed, and she's not depressed, so it seems to be doing a great job for her. But it's the studies on ketamine show that the relapse rate with depression is fairly high. But again, the method and model that they're using is just these intravenous ketamine infusions 2 or 3 to 4 times a week, and then, maybe half of the people get better, but then the relapse rate is pretty high, after 6 months. Whereas the data on ketamine for PTSD, anxiety disorders, is actually really the strongest. But again, the model, the way we're doing is I think different than what they're doing in a lot of the studies.
Gotcha. So, if we take in comparison to traditional therapies that you would use, in comparison to the ketamine therapy, do you now feel like is that a better therapy, or do you still do the traditional perhaps therapies and then this is the last ditch resort? Is that how do you see it, or not really anymore?
No, it just depends on the person and what they need. So if you have someone with a mild to moderate depression, I'm not going to necessarily have them do the ketamine-assisted therapy. I'm going to have them do cognitive behavioral therapy.
Okay.
It's going to be very helpful for them. To have a couple where someone's depressed, maybe you want to do interpersonal therapy, right? So, or maybe you have someone who has a substance abuse problem, maybe you want them in 12 steps, right? But there's evidence, for example, in all of these situations that ketamine can be helpful. So you have to kind of dig deep and see, is there trauma? Is there anxiety? Is there OCD? Just yesterday, I treated a guy, his first ketamine session, with OCD. Now, we've done all the functional medicine, and we've done neurofeedback, and we've done all these things, treated his infections, etc. And he's much better. He's even had some days without any OCD, but whenever he's under stress, it comes back. So with the ketamine, he had an amazing breakthrough yesterday, where he was able, his parents were divorced. He knew that this was a horrible time for him, but he really couldn't ever connect it to his life. And what he was sobbing. First time he actually emoted about this, from the time he was, 10, 11, 12 years of age. His parents were fighting and he became a problem child, but he wasn't really the problem. They were the problem, and his family was a mess, and he felt he was the problem. And the world felt like it was crumbling around him. And he's always afraid the world is going to crumble, and he wants the world to look perfect. So he takes a job, very smart guy, he takes a job that anyone would want, but he didn't want it. He didn't want it at all. So he started having intrusive thoughts. Well, what if I forget to answer their email? What if I forget to do this? What if they don't like me? Well, his psyche didn't want the job. His psyche wanted to be like, don't answer the email, don't take the job, right? You don't want this job. No, but I'm supposed to be perfect. I want everything to look prestige and look perfect because my family was a disaster. I need everything to look good. That's his defense. But his essence was, I don't want this job. I don't want to sit at a desk. I don't care what they pay me. That's not what I want to do. So his psyche, in this crazy language, like my example, his psyche was talking to him in a language that he couldn't understand. And that was his OCD. That's it.
And the ketamine helps them to get
to that.
Yeah.
Yeah. So now he he's unlocked the key. He understands. Now he's got some work to do. He'll have a few more ketamine sessions, and he's going to be much stronger for it.
So, how do you decide who's a good candidate for this therapy, or perhaps maybe you can talk to us about, who's not a good candidate? Because everybody listening to this might say, "Hey, is this something I should seek out?"
Yeah.
Like,
I think if you're psychotic, patients who are psychotic, probably not good.
Okay.
I'd say you want to be fairly well grounded in reality. So you can have depression, anxiety, OCD. You can have all those things, trauma, PTSD, etc. But borderline personality, I'm not sure. I don't know yet. I can't say. I don't have enough experience to say that yet. It could, in theory, I think it could be great, but I don't know. So I would say psychotic disorders, you want to stay away. People who have addiction, actually, there's data showing that it can actually help with addiction. If you combine it with mindfulness therapy, it can actually reduce the risk of addiction and relapse over the course of a year by anywhere from 30 to 70%, depending on what you do. But again, you got to be careful. So the intranasal could be very addictive. So if you prescribe it to somebody, you don't want to give them like a 3-month supply that's sitting in there.
Yeah.
Right. So you just dose each session, and then that's it. That's it.
I'm a big fan of the atrocious just for that reason. The nasal spray is very quick and it's so effective and very short lasting too.
Yeah.
Now, any side effects, perhaps, a patient may have, and that, it's nice to hear that everybody that you treat is supervised and under constant, supervision while the ketamine, and throughout the entire session.
Well, of course, there's always the risk of drug interactions, so those drugs have to be cross-referenced. Then you can have a raise in blood pressure, heart rate, not too bad. If you have cardiovascular disease, you obviously want to make sure that it's safe. Check with the cardiologist, but it's a mild increase. You can have nausea, you can have vomiting, obviously you can go into something that's fearful for you, and it's always good to have someone with you, so that they can help you process it. Nobody's going to develop a new onset psychosis from this, I don't think. So it's pretty safe. It's a very safe, essentially a very safe medicine.
Okay. So how many sessions does it take to see improvement? Is it one and done, or is it it's not or is it patient?
You'll see improvement. If it works for you, you'll see improvement in the first session.
Wow. Okay.
And then if it doesn't work, no. And then you want to build on it. So you could do once, like I said, one session a month. You're not going to do this for years. Might be 6 sessions. It might be 10. It might be 3. Everyone's different.
Gotcha. Now, I've always looked at the brain, and you think about brain health, circulation, improving circulation, things like that. Now, with ketamine therapy and psychotherapy, and especially that diagram that you showed us, where after one therapy, the brain was the wow case, that it went to gray, everything was working. So are you essentially kind of reshaping the brain as you do more treatments and making it healthier, and therefore these depression, PTSD is kind of reduced? Is that what is happening to the brain?
Yeah, I think you are reshaping the brain through multiple experiences. You're reshaping your perception of the world, which itself will reshape the brain, reshaping your perception of yourself. Plus, I should have mentioned, it has an anti-inflammatory effect, ketamine. So for today, for example, I saw a guy who has COVID and mold exposure, and looked at his QEG, and you could see it. And I got to treat the mold, I got to treat the COVID, but I'm going to do a baseline QEG, and then I'm going to give him the ketamine, do ketamine-assisted psychotherapy, and do a post-ketamine thing, and see if the pattern improved, because I might be able to reduce that inflammation with the ketamine which will obviously protect his brain, right? Meanwhile, treat the COVID, et cetera, over time. It's a Band-Aid in that sense, but that's a good Band-Aid if we can get some anti-inflammatory effect in his brain.
Gotcha. So, do you recommend any nutraceuticals or lifestyle changes in conjunction with the ketamine assisted psychotherapy?
Well, all the nutraceuticals that we recommend are very precision oriented, meaning we test, do a physical exam, review the labs, and look at the genetics, look at the epigenetics, and then we determine what the person needs. So I can't give it any kind of a general thing. I don't give anything, oh, you're on ketamine, take folic acid. There's nothing that I've found that's necessary. Lifestyle wise, we encourage people to journal after they've had a session, have the integration sessions, and really not to talk to other people about their experience. Let them process it with the therapist so that it doesn't get diluted or distorted by other people.
Wow. Thank you very much for going over this. I tell you, Dr. Hedeya, thank you for joining us. I feel like, would you agree with me to say, when you hear about doing ketamine infusions or just simply prescribing a ketamine product, let's say, that is not attached with any kind of psychotherapy, that is probably not an appropriate treatment plan?
Well, I would say, number one, there are people who are trying to do this ketamine therapy with an app. You actually have an app on your phone that guides you through this. It's insane. That's insane, in my opinion.
Okay,
now,
let's unpack that, because you know what? Yeah, please unpack that.
All right. Well, I was approached about a year and a half ago by a company that developed an app. They did a beautiful job that would they would send you your ketamine, you take your ketamine and you open the app, and the app would guide you through questions and blah, 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 and guide you through your ketamine session. And then you'd have some kind of a low-level coach or something that you would check in with you. And this is a way of, distributing it to the masses. But I'm sure it could work for some people, but that was very frightening to me. I didn't think that was a good idea. So I said, no, I'm not getting involved with this. So I think that I can't say categorically that ketamine without psychotherapy is not going to help you. I wouldn't say that. IV ketamine with psychedelic experience, with music, with an eye mask, it could help, but it's not, if you're trying to do specific work on yourself, no, that's not the way to go. If you feel like, oh, I just want this psychedelic experience, maybe I'll have an experience of oneness, okay, that's fine.
Yeah.
But if you are having issues that are related to trauma or anxiety or OCD, no, you should not do it. You can have IV, that's fine if you want, if that makes sense, but you need a therapist who's, this is very important, not a novice. You need someone, look, I'm 71, okay? I've been doing this since 1979, okay? So, started my training in 79 and practice 83. I have a lot of experience. Not that I'm so great, but I've been around the block for like 40 whatever years, right? I have life experience. I've had my hard knocks. So I've had to learn for myself. So when you have a therapist who's experienced, they can bring their wisdom to you with the ketamine. That's what you need. Yeah. That's what you need if you're trying to do work on yourself. That's really what you need,
Well, that's perfect. Let's end on that, because that's a perfect ending, to this. So, Dr. Hedeya, thank you very much for joining us today. You shared a lot of good information. And now, if someone wanted to reach out to you in your practice, how would they, or where can they do that?
They can go to my website. Actually, the website is very deep. It has a lot of videos, a lot of information. We haven't put up too much on ketamine yet. We have to build a page for that. But there's a lot of it. There's videos and all kinds of stuff. So they can go to my website. It's like Whole Foods, only it's Whole Psychiatry, WHOLE, psychiatry.com. And there's a contact link there, and then you fill out a form, and then my staff will send it to me, and then we'll go from there.
Great. And I'll make sure to put the contact information and the website URL all in the show notes. Thank you, everyone, for tuning into the Compounding Center Connections podcast. We hope you found this information presented today to be helpful. If you have any questions or comments, please feel free to reach out to me at jay@compoundingcenter.com. Subscribe to our YouTube channel and our podcast channel, The Compounding Center Connections, and stay tuned for future episodes. Thank you very much, Dr. Hedeya.
You're welcome. Thanks for the opportunity.